so let's talk about how the blood circulates through the heart.
Sounds good.
So keep in mind, so the atria are the two on the top, two chambers on top, right? They're separate from each other. Ventricles on the bottom. So the atria contract together, and then the ventricles contract together. So when you hear that lub-dub, really what you're hearing is the tricuspid and bicuspid valves closing, that's the lub. And then the dub is the two semilunar valves, the aortic and the pulmonary. Okay. So like with Jason, now he's got a third one somewhere along the line. Sounds like maybe the semilunar valves don't close at the same time. They're just like boom, 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 boom. Because either the valves are a little bit different, or maybe there's we should do a 12 lead on you today.
Sure.
Maybe the electrical conduction is slightly different, and so those ventricles don't get the signal to contract at the same time.
I always wonder what's wrong with you.
I mean, not that we can really diagnose anything, but we should do a 12 lead on you today. You got me all excited and curious.
Imagine this for the past like 8 years, and you know me.
Okay, so remember, atria ventricles. Boom, 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 boom. Okay, so blood comes in. This is a really good figure, 2010. You can really just follow the steps, 1 through, they have, say, 8 on here, and that walks you right through it. But you have the superior and inferior vena cava. Blood comes into the heart through those, goes into the right atria. Remember with the body, we're always talking about, I say the patient's, but the patient's right or left, not our right or left, right? So the right atria goes through that tricuspid valve. Try to do right. Tricuspid's on the right side. It's also called the mitral valve. Why, I don't exactly know, but that's what you hear most medically. You hear mitral valve. For this class, you're going to hear tricuspid. Goes down into the right ventricle.
So from the superior vena cava, it goes to the right ventricle?
To the right atria.
Oh, the atria.
The right atrium, I should say, and then to the right ventricle. So it comes from the inferior and superior vena cava at the same time. I mean, they're both always filling up there, and then it goes to the right atrium to the right ventricle. Okay? So atria contracts, atrium, whatever, pushes it through. Ventricle contracts, pushes it up through the, what valve is that? Pulmonary semilunar valve, and travels through the
Pulmonary vein.
pulmonary artery.
Pulmonary.
Yep. So,
That's right.
yeah, never forget, arteries go away from the heart, veins go towards. Doesn't matter if they have oxygen or not. Right? Most of the time it's true, arteries have oxygenated blood, but really, arteries go away from the heart, veins go towards the heart.
Got it.
It's only like around the heart where you can't rely on color, can you?
It's only the pulmonary.
Just in the heart, yeah. And in pregnancy. The placental arteries and veins are backwards because they're in reference to the baby's heart, but it's the mom that's actually providing the oxygen. So anyway, we won't confuse you with that, but not until later on.
Chapter 28.
Chapter 28. It actually been like chapter 29, which we don't really do. So yeah, But anyways, so yeah, it goes out to the lungs, right? Dumps off carbon dioxide, gets oxygen, comes back through the pulmonary veins into the left atrium. Atria both contract together. Left atrium pushes the blood through the bicuspid valve into the left ventricle. Ventricle contracts, pushes the blood through the aortic semilunar valve, and then it goes out to the rest of your body.
And then if it wanted to go into the coronary arteries, would it go from the aorta into the coronary arteries from there?
It's from the
Yes.
pulmonary arch.
Yes, right in. Show you. You can see from here. So you have the aortic arch. So at the base of the arch, it comes through the artery comes out to the heart here, and then on the back side, this kind of shows a ghost image of the back side of the aorta. So right at the base, we call this. So this is the apex of the heart, and up here is the base. Usually the base on the bottom. I know that's kind of confusing, but here's the base. Okay.
side is the apex.
Good. So, spend some time with that. You want to be able to say every single part that that blood travels through and the order that it travels in.
What